Good morning, everyone. Welcome to a 9 a.m. session, and I so appreciate those of you who have taken the time to come to this presentation today. My name is Micheline McWhirter, and I am the project manager for the Village Collective Impact Project. And in today's session, I'm going to talk about the current state in our region, share some data and information with you, and also share with you what's happening with the Village Project. I'm going to start off first by just going over a few housekeeping rules, or items, actually, I should say. So during the session, if you have any questions, I love questions as we go along. It helps break things up a little bit. For me, webinar style is tough because I can't see you. I can't hear you laughing because I hope people laugh. So I really do appreciate chat. On the call with me, or on this presentation with me today, I have Kelsey, who is also part of the Village Project. Kelsey appears as Josh in the list of panelists here because it's Josh's corporate Zoom account for the college. So, but Kelsey will be joining me, and we'll also be sharing some information. So again, the chat is the bottom of your, in the bottom of your toolbar. There's also a Q&A box. You can use that, but chat is fine. Kelsey will be monitoring that. If you do want to speak, instead of typing, please just raise your hand, and we can ensure that we give you the ability to unmute yourself and be able to speak during the presentation. And then this session is being recorded, so it will be made available at a later date. And as well, anybody interested in some of the slides and data, I am happy to share. We want to apologize. We've tried to organize to have closed captioning this week, and that we have had ongoing technical issues with that, with our Zoom corporate account. We haven't given up totally, but again, today we do not have that option. Before we get started with the session, though, I want to start with a land acknowledgement. And I want to acknowledge that today's presentation and meeting is on land that has been inhabited by Indigenous people since time immemorial. And the Nipissing Parry Sound District sits on the traditional territory of the Anishinaabe people and within the lands protected by the Robinson-Huron Treaty of 1850. We acknowledge that we are also situated on unceded territory of the Algonquin Nation and the settlement of the Métis Nation. So as individuals and organizations, we are dedicated to honoring Indigenous history and culture and committed to moving forward in the spirit of reconciliation and respect with all First Nations, Métis, and Inuit people. A little bit about myself. So I should have said this at the beginning. I mentioned my name is Micheline McWhirter. My pronouns are she, her. And one of the reasons I became or applied for the role as the project manager at Canadore for this particular position was that I have a huge passion for the community that we live in. And I actually, as on a personal note, I support my parents, and I supported in particular my father, who passed away in February. And when I applied for the job, I knew that my father wouldn't see the end of the project. And I have him in my mind always as a sort of inspiration for all the work that I do on this project. He passed away in February, and we were really blessed that although he was living with dementia, he was able to remain at home with my mom's love and support, and as a family, we were able to be there and support him on that journey. And my goal is really, and my hope is to positively influence the experience of seniors who live in our community. So Kelsey, how about we get started with an introductory poll? You know, I love polls. If you've been on any other session, I love a good poll.
Sounds good. So I will launch an introductory poll here. There's 3 questions involved. The first one, we're asking how you identify. The second, your age, and the third, where you're located. So I'll give it about 30 to 60 seconds for participants to answer. Slowly starting to filter in. Still early.
I know. It's 9:06. I don't know how many cups of coffee anybody else has had, but I've only had 3/4 of a cup.
Right, we're sitting at 60% right now. We'll wait a couple more seconds, allow people some extra time this morning.
While we're waiting for poll results, Kelsey, I'm going to ask for another favor. If you can tell me when it's 9:45, because I have a video that I want to ensure people get to see. I'm excited about sharing this video. It's a teaser. We're going to end with this video. And yeah, I'm excited, but I do get kind of wrapped up in the presentation and I don't want that to be missed. And I definitely don't want to go over time. We'll stop at 10 o'clock sharp because we have another amazing presenter starting at 10:30, Ava from the Alzheimer's Society. So how's that panel coming?
So we're sitting at 70%. So I'm going to end it right now and I'll share the results.
All right. That's awesome. We have quite a mix of people who are present. It's really nice to see again that we have a lot of the older adults in the group. And then we have everybody you can think of sort of represented here, from caregivers to professionals supporting people. And we have a pretty mixed bag of ages as well. That's really great. And then for location, most everybody is in the Nipissing district. We have one person in the other. We really wanted to see people from across the Nipissing Parry Sound district, and that's a challenge for sure. So thank you everybody for joining. I'm going to start my presentation now. I should be able to share screen, Kelsey. There we go. So I'm just going to get that to full slideshow mode. Are you able to see just my slides or do you see my notes?
I can see your slides.
Is it in presenter view?
We can see your slides in the next slide as well. Oh, you know what? We can see your notes.
Okay, I'm just going to, second here. Is that any different?
No.
Oh, great. I don't know why it's doing that. It's done that to somebody else. Beginning display settings. How's that?
There we go. All set.
Yay, I figured it out. All right. So as I mentioned, I am the project manager for the Village Collective Impact Project, and I wanted to start by telling you a little bit about the village. So this is a photo of the new facility that was built on campus, and the village is the only model of its kind in Canada, and the goal of the village is to become a center for excellence in healthy aging. There is a video on our website that sort of walks through in more detail, but I won't be sharing that today. So what I want to do is just give you an overview of what the phases of the village look like. So in phase 1 of the village, which is what we're in right now, it's about building collaborative interprofessional education. So opportunities for our students, not only to learn within their field of study. So say they're a PSW, they will learn alongside other PSWs. Interprofessional education sees our students in social work, PSW, rec therapy coming together and learning and having teaching opportunities together. The other thing that we have going on is we have some student run clinics, including our dental hygiene clinic. And also we have Indigenous studies and health, human care and wellness. The next is we have specialized Indigenous classrooms and ceremony areas. In June, we hope to have a symposium on campus where people will be able to tour these areas. They're just fantastic. We're so blessed with a really amazing space. We're also one of the only post-secondary education centers in Canada that also has a grandmother in residence. We have an elder on residence who works for the college and who has an office in the village. Now, phase 2 is where we really start thinking about groundbreaking approaches. And the phase 2 includes the building of a seniors living facility on campus. So we're looking at not only long-term care facility on campus, but also assisted living, but more exploring how assisted living can be affordable for all people and be an option that maybe puts less pressure on our long-term care facilities. And then this allows for some intergenerational living, but more importantly, the campus becoming a space where the community, including older adults, come, and it is normalized that we are, that older adults are there, that students are there, and that we're in this space together, learning and living together. So in 2019, the Village project received nearly $2 million for a 5-year project from New Horizons for Seniors program. And we're using a collective impact approach, which means that we are bringing together cross sectors from the community to come alongside and work together on the project. And so this is a collaborative approach and a collaboration between seniors, Indigenous seniors, families, caregivers, regional community organizations, agencies, and also businesses. So why is this important? If you were at the keynote speaker, Dr. Mary Pat Sullivan, at the beginning of the week, she talked about isolation and how that's viewed and how that's sort of portrayed as the reality for all seniors. But we know that there's a percentage of people who experience isolation, and not everyone does. But the reason this is so important to the federal government and specifically New Horizons for Seniors is that there are detrimental health effects to experiencing social isolation. So Kelsey, I think we have like a trivia poll question, right? To see what people in our audience think this morning around this question.
Yeah, I'll launch this right now. So the question is, loneliness and social isolation can be as damaging to health as smoking. How many cigarettes a day? Is it 5? Is it 15? Or is it 30? What do you folks think?
Well, I love when I see people answer right away. It gets me, oh, look at them. Come on, let's see. We'll give it another 4 seconds, 5 seconds.
Yeah, so we're sitting at 70% again. Oh, we're still, people are thinking about it. I think that's what it is.
Or you're Googling it. I
Or
know
Googling
some
it.
of you might Google it. I like to be competitive. If it was for prizes, I would try to Google it.
All right, let's share the results here.
All right.
We're pretty even across the board.
Yeah. I think everybody recognizes that it's pretty serious. So how about we stop sharing and I give you the answer? Okay, here we go. It's actually 15 cigarettes a day. So that's what loneliness and isolation, that's the effect it can have on our health and also on our mental health. So this is why it's important. I'm not going to spend a lot of time talking about isolation and risk. However, I do want to highlight that there are risk factors that make people more prone to experience loneliness and isolation. Now, social isolation has a lot of definitions. That's why I'm not an expert in this area, but there's so much material out there about that. But one of the agreed upon definitions is the objective lack of social networks and interaction and resources. So some of the most prevalent risk factors for older adults is life transitions, poverty and lack of access, lack of social connection, and lack of knowledge and awareness. And you're going to hear some of these themes as we go through. So here's another piece of information to keep in the back of our minds. When we get into, we'll talk about the data, but 16% of seniors experience, that's the data from the Government of Canada, that about 16% of seniors experience social isolation. So in our region, that represents approximately 5,000 seniors, which is a high number. So here is something for us to also keep in mind, is that the population age 65 or older is growing faster than any other demographic. And the number of seniors in Canada now exceed the number of children. And there are some predictions that senior population can double over the next 25 years. So now I want to sort of paint the picture of what's happening in our region. So our current state. So in the Nipissing Parry Sound District, you heard at one of our presentations that our population in this region is about 130,000 people. Now, this is where it gets interesting, nearly 23%. So that's almost 1 in 4 people in our region are over 65. So that's like that's nearly 25%. Now, if you look at that compared to the provincial average of only 17%, we're actually one of the oldest regions in Ontario. We're a close second to the Sudbury-Simcoe district. They're just, I think, 1% older than us, or 1% more people that are older than us. So I think they're at 24% or 23.7%. Now, in our region, this is something else that's interesting for us to keep in mind, is that the majority of the people in our district do live in rural areas, not urban. So all of our outlying areas to the North Bay, which is the bigger urban area, the majority of our seniors are living in rural areas. And nearly 15% of those over 65 have low income status. Again, we're beating the provincial average in this area. So we are at 15% of people over 65 have a low income. And so why is this data important? It's so important for us to know and understand, is as we are building programs and supports, this is the information we need to keep in mind. So more data for you. So the majority of older adults are women. So there are more women than men who are older adults. Older women are the fastest growing demographic in the North. So that's another interesting piece of information. Now, the majority of seniors, so 92% of seniors live in their homes. So when we're starting to think about, so you're looking at long-term care and solving some of the issues that we see within long-term care, we need to keep in mind also that 92% of seniors actually still live in their homes. And so a lot of our attention should be focused there. And then out of that 92%, 30% live alone. So a majority, so what this means is when we're thinking of people with cognitive issues, we've had some presentations from the Alzheimer's Society, a majority of the seniors in our region who have cognitive issues live at home. And then there's a percentage that live alone. So that's important for us to understand. And then another interesting piece of information is 1/4 of all of our seniors are also caregivers or care partners to other seniors. So that's another important piece of information for us to think about when we're looking at supporting older adults. So I have another poll, Kelsey, here. This is a map that starts to just demonstrate where some of our First Nations are located in Ontario. So Kelsey, do you have that poll ready?
Yeah, I sure do. So the question is, what percentage of First Nation communities are located in Northern Ontario? So 35%, 55%, 78%, or 92%?
I know our panelists are probably a bit jealous of people sitting in the background. They would love to get in on this poll, right? It's so fun.
It's true. I love trivia night.
So the reason I'm bringing this up is this project is not Indigenous or non-Indigenous in nature. When we're supporting people in our region, we need to think in terms of and, not either or. So why do we mention seniors and Indigenous seniors in our region? And this will help you understand. So I love that. 70% of people are guessing 78%. I see that nobody guessed 35%. So that's really, really great. Everybody has an awareness that there are several First Nation communities in the North. So how about we stop sharing that, Kelsey, and I share the
Here's your results. Here's your results here.
Oh, sorry. I think I X'd out on them. I'm clicking too much. So I'm going to put up the answer here. So it's actually 78% of the First Nation communities are located in Northern Ontario. So that's why it's so important for us to start to understand the Indigenous view, and for us to not only focus on one way of thinking and being when we're starting to do this work. So here are barriers to inclusion. So actually we're another poll right now. I'm hitting you with poll after poll. So these are the barriers that we've heard from the community, that we've seen in reports in the region, that are barriers to inclusion. So what are the things preventing older adults from fully engaging socially in the community and engaging in programming and services? So Kelsey, if you want to launch that poll.
Sure.
So I'd love to hear from this group.
Our question is, what is your biggest barrier to inclusion in your community? Lack of interest, mental health, transportation, digital literacy, lack of knowledge of services or programs, or I don't experience barriers to inclusion.
So let's hear from you. What is your biggest barrier? Ooh, interesting. I would love to see 100% almost answer. That would be really great. Come on, that last 4, go for it. Give it another 10 seconds or so, Kelsey.
So we're sitting at 70%. I'm going to end the poll and I'll share the results.
There we go. So 40% of the group today do not experience barriers to inclusion. And that's actually, you know, an experience of a lot of our older adults. They have found ways to overcome those barriers and don't even realize that. Lack of knowledge and services of programs is what we're all discovering as service providers as one of our own major barriers to supporting as well. And then mental health as well has come up as a barrier, and that takes many forms. So let's see what it looks like for the region and compared to the group that we have today. So before COVID, the transportation and mobility was the -- issue in our region. And that's multifaceted. So don't think just in terms of public transportation or other. Think in terms of everything related to transportation and mobility. So that could be the weather, the bus stops not being accessible, not having access to public transit, people not having personal transportation, so on and so forth. So the next one is lack of promotion of services and supports. That's the 50% of our group that talked about not even knowing what we have is a barrier. You can't go to what you don't know. You can't attend or receive services for what you don't know exists. Then mental health was in the top 3 of reasons or barriers to inclusion. And just to let you know, digital literacy and access to technology was in the top 10. It was just starting to emerge as an issue and a barrier for older adults. Now, since COVID, some of this has changed. But what hasn't changed is transportation and mobility being the major barrier. Number 1, and this is equal, so it depends. Whether it's transportation or digital literacy and access to technology sort of flips back and forth as the sort of main barrier. And digital literacy, as you know, look at this symposium. You know, 3 years ago, we wouldn't have had a senior symposium online. Like that wouldn't have been a thing. And all of a sudden, here we are doing it, and we are not all, we don't all have the ability or the digital literacy to do this well. We also do not all have access to technology. There are still parts of the Nipissing Parry Sound District that don't have access to high-speed internet. And if you do, it's so expensive. So think about that data we talked about, people having more people in our region experience poverty and are below the, you know, have low income. How do you afford to have that access? So that's why it's so high now. Fear of COVID has also come up as a main barrier for people to get out. Now this is changing. So this is from March 2021, and there's a lot that has changed, and I think this will slowly change, of course, as the pandemic evolves. And of course, this was all pre-vaccination as well. Then the next number 2 is mental health, and then lack of promotion of services and supports. So again, not knowing what's available. So these are what we're seeing. So if anybody has comments, Kelsey, I know you're monitoring chat. Please don't hesitate to share comments or if you have any questions. So here's a little bit about more about what else we have learned about our region and from the different groups that we've had been so fortunate to get to engage with. So 63% of to us LGBTQ plus people experience or feel isolated in comparison to the 16% of the total senior population. So this is something really important for us to understand and consider in our work. There is what we're hearing as well is there's a lack of inclusive and accessible spaces. Some of what are barriers to inclusion is that the physical space may not be accessible, but also the environment and the culture may not be inclusive. And that is for 2S LGBTQ plus seniors, for Indigenous people, having culturally safe spaces, for Indigenous people and newcomers, having age-friendly spaces and dementia-friendly spaces. I can tell you from trying to take my dad to a restaurant, he was in a wheelchair and he was living with dementia, that and going out to dinner was one of his things he loved the most. It was a very, very difficult situation for my mother and for us as family who would take him out. And then something else we know or we're learning is that 50% of the social determinants of health are not directly related to healthcare. And they include social contact, meaningful connections, and physical exercise. So there's a lot we can do outside of healthcare that will help people's overall health and well-being. And this is why social inclusion and you're going to hear a lot about social inclusion and physical activity as part of some of the work that we need to do to best support older adults. So here is if we were to summarize everything we've learned, this was the #1 message we received. So older adults, I kept saying to us all along for the last couple of years that they don't want to be helped. And at first I was like, if you don't want to be helped, I don't understand. What older adults and seniors want is to be valued. And so this information, along with everything else that we learned, is how we've put together our approach for the project. So let's unpack this for a second. And actually, I'm going to throw this question out to the group, and hopefully our chat blows up, because I'd love to hear some of your thoughts. When you value a person, what does that look like, or what does that mean? And so please, anybody, panelists, anyone who's present today, even one word, what does that mean to you, or what does it look like? Is there anything going on there, Kelsey? We've got a quiet group.
So we're getting a few comments in chat. Cindy's saying we take care of them, and Nikki threw out respect. We're also seeing to be needed, honoring their spirit in a good way.
I love that. I love that. Keep those comments coming. I'm just going to go through a list that we've helped, put together. So we listen to their stories and they speak for themselves. This is why it's so important that I end the session today with our video, because the video is about storytelling, people sharing their story. They are asked what they need. When I stopped trying to tell my mother and father what I thought was best for them, and I actually just stopped giving my advice. And if you have a daughter who likes to come up with really great ideas, like me. I had to stop doing that and actually just ask what they need and then actually listen, the top point. That starts to transform things. So when we value people, they're also included in the building of programs and services. So we don't just build a program and a service. We actually consult with the people that we are trying to support. We understand and consider the barriers they face. So if we build really great programming, but we don't have a transportation strategy, if we build a program that's delivered virtually and we don't consider digital literacy and or access to technology, then we're not really valuing the people that we're trying to support. The next is, and so important, is we value their knowledge and experience and ask for their support. So this is an inclusive list of the ways in which we value people, but it is a start to that conversation. So now what? So we have all of this data. We have an understanding of, you know, what our region looks like, what our barriers are, and what we need. And then we were, you know, given the task from, you know, the government of Canada with this funds to reduce the risk of isolation. So now what? What do we do next? So this is the start of the what's next. The what's next is our common agenda. So this is the collective who are part of the project with all of the data and all of the experience, and alongside with the older adults who have provided us feedback. This is our shared vision. So we have a collective vision that every senior and Indigenous senior is socially connected and engaged in their community. And what's so key about this statement is that it's based on what individuals want. Back to what Dr. Mary Pat Sullivan said, is it's recognizing people's individual needs, and that people being alone is not inherently bad. And so what does it look like for an individual to be connected is the goal. So our long-term goal for the project is twofold, and this is our approach. So our approach is intercultural, it's interprofessional, and it's intergenerational. That is foundational. We want to support an age-friendly, dementia-friendly, inclusive community. And we want to improve our community's connectedness and reach and connect seniors, preventing social isolation. So of all of the different service providers, so whether you're a restaurant or you work at the hospital, that we all have a shared vision around supporting this inclusive community. So we have working groups, and I'm just going to let you know some of the areas in which that we're working on. And so one of our first working groups is the You Belong Here working group, and that's to promote inclusive spaces for seniors. And we have a group of partners working with us. And if you're wondering, if you're an older adult and you're wondering how you might get involved, I'm going to get into that a little bit later. Kelsey, is there anything in chat that you want to share before I keep going?
Nothing new. Gord did add one last comment to your previous slides. I think it was the first point where he said listening.
Yeah, listening is huge. And I just to if you were able to go to either the Medicine Wheel teaching or the Storytelling with Perry, they really talk a lot about listening as the most important skill, and listening, you know, twice as much as you speak. And that's something so important. So the You Belong Here working group has a group of partners. And what we're trying to do is come up with a framework for our region that starts to look at what is an inclusive space, what is an age-friendly space, what does that look like, and how can we live that out in our community. But what's more important about this group is we want everyone to feel like they belong in the spaces in our community. The other working group is our digital literacy and access to technology working group. And this is about us creating a strategy for our region. So right now, every single organization with COVID has had to look at how to support people with digital literacy, whether it's their staff or their clients or the people that they support, and have their own plan of attack. What we're wanting to do with this is actually create a strategy for our region that every single senior has access to technology and the supports needed to use technology so that they have the maximum access to friends, family, and programming in the community. Now, our third working group is the Northern Seniors Resource Guide, promoting social inclusion. So this is about us creating a one place where we all go and we know what's happening in our community. We know what services are available. And on top of that, where we have a team of students who we call our community connector students who can help people navigate that. So for those who are not online, or for those who are online, but need support navigating the plethora of services, we will have our community connector students who will help do that work. So again, we have a list of organizations who are involved in helping with that. So here are our programs supported by students. And Kelsey, I'm going to hand this over to you. I'm going to bring these up and you can tell them a little bit about, first of all, you can share what your role is at the village, and then maybe a little bit about each of these programs that we currently have going on.
Sure. Yeah. Hi, everybody. I know that my face looks like I'm Josh, but I promise I'm not Josh. My name is Kelsey LeCaplan. I'm the Senior Inclusion Lead for the Village Collective Impact Project, and I work with Michelin on helping to reduce seniors' isolation in our region. And essentially my role at the beginning of COVID was to reach out to communities, to establishments in our community and create partnerships. But that took a turn when COVID hit, and we decided that I was really going to be focused on supporting students and allowing them to complete their placements in the community, with programs and services based around how we are supporting seniors who are isolated in North Bay Parry Sound. And so right off the bat, we started our Care Calls Reassurance Call program. And so it is social and recreational calls. We do daily or weekly calls with students who provide a social outlet for seniors over the phone. We've been doing that since March of 2020. And we have MHA, which is mental health and addictions, and SSW, social service worker students, completing those reassurance calls daily, sometimes weekly. I think we have actually one of our attendees is one of our students right now who's completing those calls. And we really see a lot of positivity coming from the seniors that we're connecting to over the phone. These seniors they can refer themselves to this program, or they can be referred from other organizations within our community who see a need for this type of service for their clients. And so we're really excited to still be able to offer that. We're also offering the YMCA Disco Hub, which is our digital literacy and technology lending program. It's a 4-week program, 1 hour per week. We started this again at the beginning of the pandemic. It was summer 2020 when we did our first pilot up on campus in the parking lot, trying to keep things as socially distanced and safe as possible. And we've been running this program at the YMCA and more recently in Corbeil at the community center. Student-led program also in partnership with the YMCA. So we do have Rhonda Krogan who's offering her expertise at that program. And we see older adults coming in who are just interested in learning about new ways to use their technology and connect with their families, whether it be on social media, FaceTime, what have you. The beauty is that the older adults are finding, working with students, that they're not feeling that pressure to, oh, you should know this, or I don't have the time to sit down and teach you how to use Pinterest or Facebook or whatever it might be. And so they enjoy that interaction, and our students love it just as much. And then new to the village, we are offering the VON exercise classes, which are not actually new to the community, but new to the village. So because of COVID, the VON had to cancel quite a few classes around the community based off of, the size of their groups and the capacity that, different, whether it be a gym or a classroom, were able to host their participants. And so the village was able to offer them our space, and they do 1 hour classes twice per week, Tuesdays and Thursdays up at the village. And again, we have a recreation therapy and a recreation and leisure services student assisting with those programs. And I think we actually have a couple of attendees online that attend those programs as well, and they're lots of fun.
There's still room.
Lots of room. Yeah, we will take a short break around Christmas, but we'll pick back up in January for those classes to continue. And then more recently, again, we've been hosting the Village Indoor Walking Group program. So we partnered with the occupational therapy assistant and physiotherapy assistant students who are so energized and so ready to get moving and mobilizing with older adults around the village. And so we do that 1 hour twice per week. Those are on Friday sessions from 9 to 10 and from 1 to 2. And we pair you up with some students, and you get to just jaunt around the campus, see the beauty that is the Upper Canadore campus. Because of the cold weather, we're doing it indoors right now, but hopefully when this program continues throughout the year, we'll be able to actually get on those campus trails and enjoy the beauty around our campus up there. So yeah, some really cool stuff going on, and we have a lot of interesting ideas coming out of the woodwork as well for programs that we'd like to offer up on campus. And I've heard a lot of great feedback from participants coming up on campus that they really feel like it's their campus, the village is theirs, and they feel that ownership and that pride. And so we're really proud that we've been able to cultivate that within the small community that we have right now, and we're hoping that we can grow that community as well over the next little while.
Yeah, thank you for that, Kelsey. I know that staff, all of a sudden the walking group started and they were hearing laughter and chatting. And so they were leaving their office and saying, we want to be part of the walking group. Why are we sitting at our desk? So we have so many great resources on campus. Like we have a Twigs, we have a Tim Hortons, we have the most amazing library. And if you didn't know, people from the community can come in and get a library card. So we really do want people to feel like the campus is their campus. Obviously with COVID, we have so many protocols in place. It makes it different. It's not open. You have to be registered with one of these services to be able to get on campus. But hopefully as the new year moves forward, we'll have open doors again. So this leads to one of the other pieces that we're working on is the creation of a seniors advisory committee. So what we're looking to build is a senior advisory committee that is comprised of older adults who basically we're asking for people to share their lived experience in their community to help improve programming and create meaningful community service and programs for seniors by seniors. So this is the idea of, imagine if everything to do with businesses and programs would be presented to this advisory group. And this is really just to help ensure that our community really is about providing and being a space that has the highest of quality of life for our older adults. So again, another interesting place where people can volunteer. So we're going to be working hard on recruiting for this in the new year. So keep that in the back of your mind. Again, maybe Kelsey can even put in chat my email. I'll share it later as well. I think for time, I'm right at the 9:45. I've been able to sort of keep track of that, Kelsey. So what I want to talk about, what I wanted to end with is, remember when we were talking about value and we talked about the importance of listening to the stories of older adults. So one of the ways in which we are going to do that is a method called Photovoice. So Photovoice is when you take a group of people who then through photography share their experience, share their journey, share their view. And it's all through the use of photos. So we actually, because of COVID, Photovoice is typically done in person, and it's something you get together and you take photos, and then we do a big display that's kind of like an evening night event of, we print some of the photos and we do videos and so on. Obviously, we haven't been able to bring all that to life yet, but we were really, really blessed with a group of women from Women to the Power of 10. This is a picture of some of the people in the group. These are the women who participated. They agreed to try to do a virtual Photovoice. Gosh, we learned a lot. Where each of them, and it's during a pandemic, during the biggest lockdown, we did this, where people couldn't go anywhere. So like, how do you take photos of what it's like to age in the North, what their experiences are like when you're not supposed to leave your house? Anyway, you'll see by the video some of what we put together. We're going to be using Photovoice throughout the project to gather the voices of seniors and to also share this. Eventually, we want to create a video that can be shared with policymakers, with the people in our community that, you know, have a say in the way our community goes. So people like in the municipalities, people who run the big organizations, and we can share this video to, you know, help people think in terms of the real message, not just what shows up on a piece of paper. So I have a picture here of Casey with her. This is Casey Spencer with her grandpa. Casey is the student who came alongside and helped put this Photovoice video together. We're actually preparing for a big presentation in June. And so here is, I'm going to play the video. Hopefully this works. I'm just crossing my fingers. What I want to say is, you know, we need to look at the data to understand the problem, which we've done. But unless you tell me a story, I won't care. So this is why we want to ensure that this outlet is available. Now, if you're somebody who would love to explore Photovoice and be part of this, it is a very individual journey as well as a collective journey. And again, please email us if you're interested in that. So Kelsey, I'm going to press play and please let me know if this is going. The music should kick in just a few seconds. Do you hear music?
Yes.
Uh-oh.
And you know, we're walking through what we probably walked through many, many times, but we're looking at nature with different eyes and how it's feeding us. It's feeding us. This has been critical, and I think most of you would agree, this has been critical to our thriving through COVID.
I was going to say, I think in our pictures too, we have to be careful that we don't have all pictures showing all of our limitations. You know, we've got pictures with seniors not being able to do this, no there. We're a pretty joyful crowd, and we do a lot of neat things, and we're energetic, and we're out there in the community. I think if we're going to change people's attitudes about seniors, they have to realize that along with the pills and the blood pressure machines, this great stuff is happening too. And maybe we can't run as quickly as we used to or climb as high as we used to, but you know what? We're out there doing stuff. And we're enjoying life and getting joy every day out of what we do and see.
Because what we're suggesting in a lot of this is culture change. You know, changing our North American culture, you know, and being a more caring society.
Another side of this, when you do not have a husband who clicks their teeth and all those things that happen, and there's silence. Because you're living alone and having been alone for a long time and having gone through most of those experiences that you're all sharing, caring for somebody who is dying and family and all of this sort of thing. Then there's, when you get through all of that, the silence, nothing being there anymore that was.
I believe that wisdom doesn't come just from age, but from experiences. But definitely working on this project has influenced me in ways I can't even tell you. It was the biggest gift I've ever been given in my life, was to become the project manager for this. As a support to my parents, if I can think of this journey that I'm on as not a burden, but a blessing, then it really changes the way I approach my parents. And it's back to what we said was our biggest lesson learned for the project, which is older adults don't want help, they want to be valued. And how do we act when we value people?
The video always gets me, and I would love to hear some of your comments about the video. I think what the video does is start to put images to all of the things that we talked about from the data. A couple of my photos that really stand out, and all of the photos that you saw in that video were all taken by the women who are part of the Aging Unfiltered Photovoice group. And it's that chair with the groceries. And to give you a little bit of context behind that, one of the participants was supporting an older neighbor who was in their 90s, and because of COVID didn't want to have contact. So they had this system of dropping off the groceries in the garage, and the book being used to like put the receipt and the money and all that kind of stuff right in there. Came up with that way to support each other. So on this slide, there's some information about how to contact us. There's a phone number there to reach us. So if you want to know more about the project, about becoming a partner or volunteer, please reach out to us. So I'm just going to stop sharing here because we're almost at the end of our time. There's only like a minute or two. And I wish I could stop sharing. There we go. There we go. So yeah, if anybody wants to share any closing thoughts about the video or the presentation, if you have any questions, please feel free to add that in the chat. Thank you so much for everybody who attended this morning. It has been my pleasure to present. And oh, thank you, Miigwech, thank you as well. And so that'll conclude the session. Thank you so much, everyone. Thank you, Lorraine.